So let's take a step back now and talk about the exam, starting, by the way, with the preclinical exam. Because the preclinical exam, I had to have a conversation with her about health. What is health? And I had to help her understand that we can find that together and find out what's appropriate for her that's in an individual way. And that's a big deal for her, as opposed to just, this is what happens when you have veneers and this is what happens when you have pain. So during her exam, just so you know, her joints on a lateral pole, so when I palpated the lateral pole, the right side had moderate pain, left side was within normal limits. As far as joint sounds or events, the right side had an early opening and late closing sound. The left side had just an early opening sound only. When I loaded her joints, we did the load test, it was actually negative, so her load test was within normal limits. As far as muscles go, bilaterally, she had bilateral tenderness, moderate to severe, of the masseter, temporalis, suboccipital, trapezius, and medial pterygoid. Bilateral, moderate to severe on all those. And then on the left side, she was actually quite severe with the SCM, the sternocleidomastoid, and the anterior digastric. So a lot of muscle pain. As far as the functional part of her exam, when she opened, she had a slight deviation to the left upon opening. Her range of motion, though, was actually within normal limits, left and right, and range of motion opening. Her first point of contact was the upper right premolar, and her slide from that position into maximum intercuspation was just about a half a millimeter. So her slide from what we'd call fully seated condylar position to maximum intercuspation was only about a half a millimeter, just slightly to the left. So, what was her initial treatment? Where did we start after looking at this whole exam? For me and for her, it was to finish the diagnosis, because I'm still wondering, is it joints or is it muscles? For me, what was the best way to start and how do I test my hypothesis? It was actually using an appliance that could create a stable environment so that I could visualize, so that we could both visualize where we could go and even practice it. That's the beauty of it. It's like doing a live, reversible, because I can take the plastic out at any time, equilibration. And I used it for two purposes. One is to treat the pain, right? That was what I was hoping for. And to help clarify for me and the patient that we could do it. I wanted to prove to ourselves we could create comfort before we did anything to teeth. It seemed to be the safe place for two people that didn't even know where to start, right? So that's what I did. Believe it or not, yes, a couple months down the road, it was amazing. It was amazing to me too, I'll tell you. That a couple months down the road, she was completely pain-free. She was taking nothing every day. She was wearing the appliance virtually 24 hours a day, except she would take it out when she eats. Now again, I'm not going to go deep into bite splint therapy, not in this module anyway, but I just wanted to fill you in that yes, basically pain went away. We proved to ourselves we could create comfort in a real healthy, harmonious situation. So now we move on to what you're here for today, really, which is facially generated treatment planning. We trust the process. No matter what's going on, we go through these steps. And so we start with aesthetics. So we look at the photos we started with, lip at rest. And at 39 years old, she's not showing much. So we think to ourselves, well, I could add, maybe a millimeter, but remember where her teeth were with all that, and when we looked at her face. If you go back and look at that photo, her teeth had been pushed back from ortho. So her upper lip didn't have a lot of support. So I thought to myself, okay, let's test this right now. So let's add maybe a half a millimeter right now and look at how that would look in her smile. This is the beauty of photos. So we go to her smile and we add about a half a millimeter. And, it almost touches her lower lip. So I'm thinking to myself, I think this might have something to do with upper lip support because really the edges are almost in about the right place, maybe just a smidge longer. So we let the laterals follow and the cuspids follow because we just trust this process. And this gives us an opportunity to even look farther back if we want to look farther back. And we go, oh yeah, that one premolar on her right, the left of your screen, also looks a little bit shorter than the one on her left or on the right of your screen. So now we've truly put the front teeth where they were with some intention using photographs. And again, we outline what she has, put it on a black background, and we start to see the irregularities or asymmetries. And then we say, okay, if that's the case, let's put those edges where we want them and run it across for what she has. And then we come in and do the proper height to width ratio, right? So we go, that's where we want the edges. And we look at proper height to width ratio now. And everywhere that the yellow dotted line doesn't meet the white right now is something we have to have a conversation about. Whether it be the width of the teeth, the height of the teeth, it's something that we're going to have a conversation about. And what I want you to do right now is just say, okay, trust that process and know that's coming. Let's move on. And what do we move on to? We move on to bottom teeth, right? So on the top teeth, here's where we want it. Here's where she is. Here's where we want to go. Done. On the bottom teeth, we can look at any photo And we say, man, where should her bottom teeth look? Well, I don't see any bottom teeth of her front bottom teeth at all. And I can barely see the tip of the premolars and maybe the cuspid on her left. And so we just pick a spot. We go, maybe somewhere right in through here. And we pick that spot and we say, so I'd like her lower teeth to be somewhere like this. And we've picked it. We've picked where we want her teeth and her face. And that then is the aesthetics part of EFSP. We've done it. We've put the top 6 teeth where they belong in her head, and for her we went a couple farther back, and the bottom 6 teeth where they belong in her head.